Hello, I'm Dr. Tracey Skale in another mindful moment from Encompass Training and Consulting. Today we're talking about bipolar disorder mixed state. Bipolar disorder is a complicated illness, it's cyclical in nature, and people go between phases of bipolar depression, mania, and sometimes mixed states. Mixed state is probably the one that people don't know much about comparatively. But the mixed state is probably the most dangerous state and the most uncomfortable state for the person to be in. The mixed state means that you have elements of both depression and mania simultaneously. As one patient described to me, it is the worst of both worlds. And as the clinician seeing the person before you with a mixed state, you feel so sad for them because they are incredibly uncomfortable. I think that a mixed state is what we used to call, when I was in medical school, they talked about agitated depression, which there really isn't any DSM-4 diagnosis for. But what it is the person has very high energy that you would see with a mania, so they have an elevated state. They're not euphoric though, they are probably more irritable, if anything, and definitely have a depressed mood. So they have high energy, dysphoria, they're agitated, you will see them wringing their hands, crying, desperate. This is a very dangerous situation for the person to be in. They really feel terrible, and sometimes they don't see any hope. This is the state that has the highest risk of suicide associated with it, even more than bipolar depression. People with bipolar mixed state are much more likely to commit suicide than people with mania or depression. So it's definitely something that we need to be aware of. We need to reassure people that there is hope for this situation. There are definitely medications that can be helpful and a variety of other factors as well. But it's important to recognize that it is part of the bipolar presentation. It's not always pure with the bipolar disorder. You may present depressed, you may present manic, but this mixed in between stage is tricky. Typically, you're supposed to meet full criteria for major depressive episode as well as mania. But there can be combinations of, you can have predominantly depressive features with some of the manic symptoms, or predominantly manic symptoms with some of the depressive symptoms. But it's a high lethality state that we have to use extreme caution.